Earthquakes, war, pestilence, and famine. These are the signs of the end times. Last time we looked further into the polymer £20 note distributed in the UK and found out that JMW Turner, as well as being a painter, may have been a pirate.
My father was not a pirate.
And if not, we do know that the symbols and markings that are on the £20 note are not of 5G or the Corona, but they're in fact giving honour unto Margate Lighthouse and unto maybe the philosophies of the law of the sea. In part 1 and 2, we looked at some signs and symbols together. Now, let us observe some happenings and events from around the world, beginning with the coronavirus and the relationship with event 201. Last October, we ran a massive simulation on a viral disease outbreak. This is what we learned. Experts have long warned about the threat of a global pandemic, and governments and organizations have tried to plan for one. So in October 2019, we ran a simulation in New York. Organizers invented a disease. Mocked up news reports predicted the effects of an outbreak, with the public encouraged to join in via a virtual forum.
Participants are confronted by a hypothetical scenario that presents to them the challenges of a response. So we will say, here's a hypothetical disease outbreak. This is the way it might be evolving. And these are some of the challenges that you'll see that you'll have to address to address the disruptions that you're seeing to your healthcare system or to your organization. The international community has never done enough to respond to global health security challenges. That we knew before COVID that the world was underprepared for biological risk. If you would have asked, do you think the world is prepared for a pandemic? I think everyone around that table would have said no. But it's when they walked out, I think it's when we really knew that if we are going to get ready, we need to have operationalized and integrated public-private cooperation that we haven't seen before.
Just in case that wasn't clear, the World Health Organization and businesses and governments from around the world, including Bill Gates and Melinda Gates, participated in this mock pandemic exercise called Event 201. This took place in 2019 before COVID-19 went public and was given a name. The coronavirus was already in existence. What were Bill and Melinda Gates, representing the Gates Foundation, doing participating at such an event? And did all things go to plan? Considering that this pandemic exercise was a mock-up of a non-existent virus, they did a good job of actually responding to an existing virus. Many have asked the question, was this all planned to seek global domination? Is this part of another agenda? Well, in fact, some people have been questioning, is it related to Agenda 21, a bigger scheme of events to unfold? And note to self, the coronavirus killed 65 million people around the globe in this pandemic exercise. Many have asked, will the results of the pandemic exercise emerge into the real world? They're quite concerned, and rightfully so. American President Donald Trump has coined an expression, flatten the curve, thus explaining a government's efforts to flatten the curve and the rising peaks of the death toll around the coronavirus.
In epidemiology, which is sort of the study of populations, when we look at an illness like COVID-19, we see an initial little bit of a flattening where people are sort of saying, yeah, we know something's going out there. And then at a certain point, it reaches a certain area where we see a spike in the number of cases and the number of fatalities. And the whole idea of social isolation is to try to bend that curve. In other words, to prevent that big spike. We know that there will be some cases. We know that there will be some deaths, unfortunately, but we want to minimize that as much as possible. The rules seem to change day by day and hour by hour. But if we look at other epidemics and other worldwide pandemics, we know that by learning from what we've had in prior cases, things like Spanish flu and plague and things like that, that if we can get people separated where they're not spending a lot of time in close quarters, we can really make a difference in terms of minimizing the effects over time on large numbers of people.
This kind of statement from governments is echoed around the world and can be seen in even the United Kingdom with its NHS policies and rhetoric. And as citizens of a nation owned by a government yourself, you can also see the effects of social distancing, healthcare policies, and even shopping procedures in a place near you. In fact, these kind of restrictions have taken over the whole world. So, in the terms of an agenda, we're all involved in one, whether we know it or not. The question is now, to what extent do we depend on someone else for our freedom? Or also for our survival? In the matter of responding to the healthcare crisis around the globe, the Gates Foundation have put forward that they indeed will carry out the vaccine proceedings. And they will develop their own type of vaccine to administer around the globe. This will also be assisted by other agencies and governments, primarily the Chinese have a big stake in output. From a UK perspective, we can certainly see these additions to the law and policy taking effect by the day. In fact, now news articles are reflecting that citizens can face a £1,000 fine or a custodial sentence for refusing to take the vaccines. Many have the feeling that this will spark a natural resistance in society, that of which the government are well prepared to quell. With a war on coronavirus announced, what part do you have to play? In this episode, we looked at the pandemic exercise event 201 and the participation of Bill and Melinda Gates Foundation and how they'll be administering the vaccine, or at least paying for it, around the world. The virus mentioned in the pandemic exercise event 21 turns out to be the same virus, COVID-19, which is prevalent in our globe and societies today.